I'm Dan. I'm the representative for Carestream Dental in Minnesota and North Dakota, and I'm here with Dr. Wes Mullins, who is a mentor for Restorative Driven Implants, an organization that specializes in implant education. You might also recognize Dr. Mullins from the popular dental podcast, The Dental Guys, where he and Dr. John Rogers, who's also a mentor for Restorative Driven Implants, discuss a wide range of topics related to dentistry. It's definitely worth checking out if you haven't already. Restorative Driven Implants currently offers a 3-part course series twice a year in the spring and the fall, culminating in a hands-on event over 2 days where you and one other dentist are going to be partnered with one of 16 mentors currently from Restorative Driven Implants to place a number of implants on patients ranging from fully and partially guided to learning freehand techniques. RDI also holds a master series twice a year. More information on these courses can be found at restorative-drivenimplants.com, or you can reach out to me for more information too. So, Dr. Mullins, thank you very much for doing this.
Dan, thank you so much for having me on the podcast or whatever you'd like to call it. I'm a fellow podcaster, and I appreciate you bringing me on to talk a little bit of shop this morning.
Well, it means a lot to me that you would even call it a podcast. This is more of just like an interview, very small time. I don't want to do what you do. You're so good at it. I'll leave that to you guys, okay? So I've got a few questions for you just regarding the course, just to get some information out to the community. It's very important. So, what are your thoughts, first of all, on why dentists should choose restorative-driven implants?
Yeah, the thing that I think that when this all started, it started out as over 10 years ago, really, as I grew as a teacher, training dentists in all aspects of dental implants from a standpoint of restorative, like how do you restore a dental implant? How do you take an impression, to other doctors who wanted to get more involved in actually the surgical portions. And as we kind of started with just small steps, I mean, we were just crawling along, we started to get a lot of good feedback, and it really led us to developing the curriculum that we have now at Restorative Driven Implants. So the number one reason I think people would want to choose Restorative Driven Implants is really the small teacher to student ratio. We really work hard at making sure that, especially doing the surgical part, that we really reduce the number of students in a surgical operatory, and we pair up 2 students with 1 mentor, and you spend all day with that 1 mentor. And then here's what's great, because everybody has their own little nuances as teachers. You want to experience things maybe a little differently, maybe from a standpoint of like nuances and maybe how you would do something, and maybe that you would learn something maybe a little bit different from a standpoint of like, try this method here. We pair up, those same students get a new mentor on the second day of surgery. So that small class, of 14 to 16 students paired up with our mentors, 2-to-1 ratio. But then the second reason I think that I would choose restorative driven implants is that we have a systematic way of teaching how to place and restore dental implants. So for instance, what is a system? It's a repeatable way of doing things over and over and over again. And so the way that we've built this system is we've, proved it, right? And so when you build a system, you review it, refine it, you trash it, you try to break it, you try to make it the best it can be. And we don't want to say that implants are cookie cutter, but when you're first diving into dental implants, whether you're a specialist, and we've trained specialists at restorative driven implants, or whether you're a general dentist and you're looking to bring that on as an adjunct to your practice, you want a way that's predictable, that you has been refined, and pairing up a system with implants really helps take a lot of the complexity out of placing dental implants. And so with today's technology, and that's another third reason I want to say why you would choose it, is because we use technology. I don't know of another class that teaches implants across the world, really, that's been using fully guided surgery as long as we have. Fully guided surgery is essentially you're guiding the depth, the angle of all of your drills. Okay, so depth guided drills through a guide, angle guided drills, and then not only that, we're able to place the implant depth and angle guided through the surgical guide. Now, that's amazing. Now, not only do we teach that, but we also teach the free-handed aspects, because sometimes you just need to really, be the doctor and back up for a minute. And is this working out like I planned it to be with the CT technology that we have, with the digital scanning technology we have? Does the guide fitting properly? So you've got to teach free-handed, but you've also got to understand that technology has came to a point to where we can use it in our system. And so I think our technology is fantastic at restorative driven implants. I think the implant system that we've chosen to bring into restorative driven implants is like none other in that aspect. Another reason that I would say, this is the fourth reason that I'm done. There's a lot of reasons to choose, right? I'm picking out the top four here. Is that we are about this stable tissue concept, okay? And if you know Tomas Linkovicus, I'm a huge fan. I've read his literature on basically zero bone loss concepts. If you haven't seen that book, read that book and you're going to learn what restorative driven implants teaches. It just so happens that as we were developing the curriculum through literature base and through practical base, knowledge, that we put all that together, and then this book comes out. And just so happens, if you want to check out, I've interviewed Dr. Linkovicus on the Dental Guys podcast, and you can check out those episodes. But that book is restorative driven implants, because we use literature and practical knowledge to bring together this system. And you want something that's not just it works good in my hands type of course. Let me show you how I do this. This is literature based and practical based knowledge. It is amazing. Dan, I know that was a long answer to question number one, but I love restorative driven implants, and I think everybody should have an opportunity to experience restorative driven implants.
Oh, that's beautiful. So no, that kind of, I'm not even sure if my second question is going to be practical here, but I mean, do you have any additional thoughts on the quality of the training that doctors can expect?
Yeah, that exactly. If you're looking for something that is research backed, right? And you're also looking for experienced teachers, right? The teachers at Restorative Driven Implants have been placing dental implants in their practice for a very long time. So what is that? What is a long time? Well, you look at Dr. Jan Bublik. I don't want to share his age or anything, but he's not much older than I am, and he's been placing implants all of his career because he's a trained oral surgeon, and also a very successful surgeon. He teaches and does a lot of master series courses, so he's highly skilled. Dr. Adam Kruger and Dr. Millard, both MISH trained implant placers. Myself, I learned at UT Medical Center in a general practice residency, so trained there, and then from there went on to study dental implants in some of our larger organizations like the Academy of Osseointegration, John Rogers as well, and similar training as myself. And so some of those are just the core faculty members. But I tell you something else that brings quality to this is the restorative part, right? Because if we place an implant, right, that's not able to be restored, then the restoration, which is what the patient wants, is not really great, right? Because people want teeth, they don't want implants. So if you're looking for the type of education that not only teaches how to place, but how to restore, right? Because ultimately it doesn't end, surgery doesn't stop at surgery, right? It's not done when you place the implant. It happens to the restoration impacts that implant as well. So it's super high quality.
Wonderful. So now I know that it's going to be a little subjective in terms of what resonates the most with the folks who attend the course. But
Mm.
what's your hope on what the biggest takeaway is going to be for the doctors that receive
Implement,
the course?
yeah, implementation. right? I think that everybody wants to come back and actually do this. That's the hardest thing. One of the things that we did is we took Dr. Todd Haley, who is a very successful businessman. He's a dentist. He's also one of the mentors during the surgical feature. His daughter has been through our course and is a practicing dentist, and we've brought her on to help train dentists as well, because she's excelled in dental implant placement in her own practice. But Dr. Todd Haley, who has, um, you know, 10 to 20 years of experience placing, but not only that, is he's a businessman and owns many dental practices, and has been able to implement this across his business. And so he teaches an implementation uh, course that actually we've done in a video format, so that you can take this back, take your team, and get your team on board. And this team component, right? We allow assistants that are in those dental offices as a part of the class fee can come during the series 3 surgical portion. And guess what? While we're upstairs placing dental implants, your assistants are being trained on what to do in the office. And I think that is a big takeaway, because, hey, go to a course, come back. How many times do we implement it? Right. And if you get your team on board, right? If you get your team excited about what you're wanting to do and they see it, then it actually happens, because we know when you walk out of the room, doctors, the patient looks over to the assistant and says, well, what would you do? Would you let this guy drill a hole in my bone and place an implant? And I think if your team's on board, you're going to be successful. So that's a huge takeaway.
Absolutely. Now, what are some ways that you anticipate that the experiences are going to benefit dentists who attend?
Yeah. So here's the thing, is that I think that everybody wants community, you know? Today, it's even more important that we have that face-to-face interaction. And restorative driven implants, obviously, there's an online portion, and then we back that up with series 1 in person, and series 2 in person, and then series 3 in person. But what happens is like, what happens to the community after it's over, right? And we've put together, like it or not, a forum where you can post cases, and we've really kept that to where there's no drama. It's a lockdown community where actually you can feel free. It's a safe place to post your successes, your failures, your questions. We're available, right? And to me, that's the biggest benefit, is the camaraderie, one, that you're going to get when we go there, the community that we're trying to create at Restorative Driven Implants. And you want somebody to come alongside of you, right? And kind of like be with you while you're there, right? And then what's great is you can reach out to that person that maybe you've met, or maybe post a question and you feel like you're going to get a great answer. Like, we're here to make people successful. So we're helping to create community.
I experienced that firsthand being there just for that surgical portion in Wisconsin just this last time that you guys had it. Not even as a dentist, just as somebody who was observing. It was really a neat thing to see.
Dan
Can
and
you
I
give us?
never really, Dan, just sorry to interrupt, but I
That's
never really
okay.
did get, I was so busy this past weekend, or the past weekend we had our surgical portion. At some point, I want to experience some of the things that Carestream's offering, right? And because, you guys had a booth set up there, and we appreciate that sponsorship of Restorative Driven Implants. And there's some VR stuff that you had there, and I've heard just some great things. But I felt like I ignored you, but I wasn't ignoring you. I was trying to just, maintain the education that we were doing. So,
You had a goal. You were set out to achieve it. Everybody wanted to come and check it out too. Time was that you didn't have a lot of it. So no,
mhm,
it was a really good experience nonetheless. Now, can
yeah.
you give me one highlight of your experiences as a mentor for restorative driven implants?
So I think that one of the things that gets me excited is I love teaching not only to place dental implants, but to teach a traumatic extraction technique, and to unlock, right, what we feel like is a difficult extraction, and for the doctor that's attending restorative driven implants. And systematize even the extraction process and kind of break the mold. And then the tooth comes out. And then every single time, whenever that tooth comes out, and they look over to me and they're like, oh my gosh, that never happens, right? Or that shouldn't have happened. Or how in the world, what is this you're teaching me here? And I'm like, it's not it's not some magic, right? But I tell you what, that's the magical moment for me. The atraumatic extraction technique. I mean, once the tooth's out, when we're doing immediate placement at restorative driven implants, immediate placement, and once the tooth's out, really the pressure in the room drops for every doctor. And now it's just we're following that system. But I love helping people really break down what is really difficult for a lot of dentists is how to take teeth out without laying flaps, how to take teeth out without tearing tissue. And every single time I get this look like I'm like they're like holding the tooth up in the forceps and like they're like how? And I'm like because it's a system, right? So that's probably the highlight every single time I get that look. And that look is a light bulb turning on. And you know how many people actually message back or leave reviews or even today some of the mentors that I've trained that are now teaching, right? They're like, these techniques have totally changed my practice. That's what gets it, right? It's totally changing the way we're doing dentistry, and that's what it's about at Restorative Driven Implants. I'm excited. I get passionate. That's why I probably talk too much, but this is good. So we enjoy teaching. All the mentors are just down to earth, practical people. There's no arrogance, and we just love helping people achieve greatness.
No, that's beautiful. Thank you again, Dr. Mullins. I'm particularly excited about this because there are so many local dentists who are hungry for education on this topic. Now, I deal in helping implement the technology that gives you the clinical information to be successful with this type of a thing. But bridging that gap into what you guys do is a massive help to the local community. And now we have a well-developed program right here that checks all of the boxes. It provides, complete training and ongoing mentorship. And for folks here in Minnesota, you may be happy to learn that in 2022, the beginning part of the course series, starting in January, is going to be held right here in Minneapolis. So with not only the spring session, which I think there's only a couple of seats still available, and that was as
Yeah.
of a couple of weeks ago. That may not even be
Mhm.
the case anymore. But we do have also the fall series that's coming here to Minneapolis as well. So in case you missed it, for more information about this implant course, Restorative Driven Implants, please visit restorativedrivenimplants.com or reach out to me or your local Carestream Dental rep. So again, thank you so much, Dr. Mullins, and we're looking forward to the next opportunities.
Thank you, Dan, so much.
Take care.